my name is Annette Dobbs, and this is my didactic physical assessment for nursing 210. Hi, my name is Annette. I'm going to be doing a head-to-toe physical assessment.
Hi.
I'm going to first by visually inspecting the skin. The skin appears to be a light tan, minimal tan lines noted on the arms, the legs, and the ankles. Taking a look, you've got mild pustules across the nose, mild blackheads. It does appear to be smooth. Client has a clean shaven face with no signs of folliculitis. I'm just going to palpate if that's okay. Skin is cool, dry to touch. No signs of varicosities or edema noted. Just checking recoil for hydration. Client does have good hydrated skin. Client also has male pattern hair distribution across the face, the upper body, and the lower body. Do you mind if I take a look at your fingernails? Just taking a look at, and also noted on the left arm is a medium-sized birthmark. Taking a look at the fingers and the toes. Brisk cap refill. And all the nails do adhere well to the nail bed. They are smooth, they are well manicured. No signs of ridges or opacities. Alright, if you would go like this for me. Perfect, and just move along, and your thumbs. And with that, we're looking for the curvature of the nail. The curvature is 160, no signs of clubbing. Moving on from your skin, going to move on to the hair, visually inspecting the hair. The hair is thick, coarse, it is dark brown, no signs of alopecia or foreign bodies, no lesions or pustules, no folliculitis noted. Any pain upon palpation?
No.
No crepitus noted, no pain as the client stated, and the scalp is freely movable. Standing back, looking at the head is normocephalic, it is atraumatic, it is within proportion and midline to the shoulders. The client is able to hold it upright without any involuntary movements or tics. I'm going to now move on to the cranial nerve number 5, the trigeminal nerve. And I want you to close your eyes, and you're going to distinguish, this is sharp and this is soft. You ready?
Yep. Sharp. Sharp. Soft. Soft. Soft.
Perfect. And again, that's cranial nerve number 5. So again, visually inspecting the face, if you would smile at me and close your mouth and smile and puff your cheeks and stick your tongue in each side and purse your lips. And that's cranial nerve number 7, the facial nerve. We're going to palpate. You just tell me if there's any pain. The paranasal sinuses, the preauricular, postauricular, occipital, subtonsillar, submandibular, and submental. Anterior cervical chain, posterior cervical chain, deep cervical chain, and clavicular. Any pain noted with those?
Nope.
So if you would stick your chin up for me and take a deep swallow. Perfect. So as I'm doing this, I'm watching the trachea move midline. There's no deviation in the trachea. There is no jugular vein distension. I do see a pulsating carotid, but no carotid distension. I'm going to now auscultate the temporals and the carotids for any bruits. There are no bruits noted. I'm going to move around to the back side. And our thyroid gland is not visible upon inspection. If you would lean your head to the left and take a deep swallow. So with this, I'm palpating the right side of the thyroid. And lean your head to the other side, and then I'm palpating the left side. And it is smooth. There are no calcifications or nodular aspects to it. As I'm standing back here, we're going to palpate the paraspinal muscles. Any pain? Alright, and if you would move your hands against or your shoulders up against resistance. Perfect, and down. Perfect. And that's the spinal accessory nerve number 11. Also, to check range of motion of the head, if you would turn your head to the left against, perfect, and against right, perfect. Moving back to our facial gymnastics, if you would jut your chin out for me against resistance. Perfect. And again, that's number 7, facial gymnastics. Moving on from our head assessment, we're going to move on to your eyes. And inspecting the eyebrows, they do start laterally out from the outer canthus of the eye, moving in and becoming more sparse towards the midline. They are a normal sequence of hair pattern distribution for this male. Moving on to your eyelashes, they are evenly distributed. There are none missing. Noting that they are curved up and out. If you would close your eyes for me. And I'm just palpating the lacrimal sac. Any pain there?
No.
And noting that the palpebrary fissure is symmetric and even from the outer canthus. If you would try to open your eyes against resistance, perfect. Taking my pen light, if you would look straight at me. So just noting that the conjunctiva is pink, the sclera is white, clear with minimal vessels noted. The iris is brown. The pupils are equal and round. And if you would just fix your eyes on the wall. And it does appear that the eyes are equal, round, and reactive to accommodation bilaterally or consensually. Again, taking a look at the eyes, the optic nerve number 2 is the cranial nerve number 2, and testing for vision, we would take a look at our Snellen chart, which is the big E on the wall, visualizing from 20 foot away. Our client would take a look at this chart sitting down or standing up, and if you did wear special lenses, he would do it with and without. The goal of the Snellen chart is 20/20 vision, meaning that the client can see the Snellen chart 20 foot away at what a normal person with perfect vision would be able to visualize. The other test we would do is a Romberg's test. This is the chart that sits closer to the patient at 14 inches. The patient is able to read, and the hopeful score would be 14/14, meaning that our client could read 14 inches at what a normal person with perfect vision would be able to read. They would read right to left, up and down, and they would read to the lowest number line they were able to read. And in able to score points, they would need to read more than 50% of that line. Our other test we would do is accommodation or confrontation. So with this, you would sit about 3 foot away from the patient on the same plane. Ask them to cover their eye. Perfect. And tell me when you see it.
Yeah, see it. See it.
Perfect. Tell me again when you see it.
I see it. See it.
Perfect. And our goal would be peripheral vision, that I see what the client sees. And we would do that bilaterally on both eyes. Our other test we would perform the cranial nerve number 3, 4, and 6, our ocular motor nerve, our abducens nerve, and our trochlear nerve are all for extraocular eye movement. And I would first have you trace the pen. Don't move your chin. Perfect. And the client is able to do that with ease. No deviation of the eye, no extraocular eye movement. And I'm just going to point straight in. For this, we're looking for the twinkle reflex, and it is present. If you would cover or look straight at the wall, cover your eye, one eye. All right, and if you would look at this, perfect. And now remove your hand and open your eye. Awesome. So both eyes do deviate over when the client removes his eye. With that test, if that was unsuccessful, we would do a cover and uncover test. Now I'm going to take a look in your eyes if you look straight at me. With this, I'm standing about 3 foot away, looking for the red light reflex, and it is present. Also going to look up close, visualizing the fundus. It is creamy yellow, visualizing arteries and venules in a 3:5 or 2:3 ratio. Also visualizing the optic disc, which is about 1.5 millimeters in diameter. Also visualizing the macula, which is avascular. And we would also visualize the fovea centraris, which is the center of vision. Taking a look at the corneas, we did say that they are equal, round, and reactive to light. Now I'm going to take a look in your ears. Visualizing the external canal pulling out and up, minimal cerebrum, minimal hair distribution, the tympanic and membrane, is pearly gray. Visualizing the umbus, the malleus, the paratins, and paraphysiolae. I would also visualize the cone of light in the ear. It's going to be at 5 o'clock on our right side and 7 o'clock on our left side. We're going to look at our acoustic nerve number 8, doing a Weber test and a Rhines test. You would tell me where you feel it, left, right, or middle.
Middle.
Perfect. And now for our Rhines test, any pain on the mastoid process?
No.
Perfect. And tell me when you stop hearing it.
No.
Tell me when you stop hearing it.
No.
Awesome. So we just proved that air conduction is longer than bone conduction with testing the acoustic nerve number 8. I'm also going to perform a whisper test. If you would cover your right ear and repeat what I said.
The cat said meow.
And cover your other one.
The dog said woof.
You can hear. Good job. And again, that's our whisper test. Coming down to your nose. Your nose is midline. It is symmetric. It is in shape with your face and size with your face. If you would cover one side for me and breathe, and cover the other side and breathe, and it does appear to be patent. Close your eyes. We're going to test your olfactory nerve. Cranial nerve number 1 is the olfactory nerve. And tell me what scent you think this is.
Cinnamon.
Perfect.
Some sort of
Okay.
cleaner or
I tried to
air
get
freshener.
really smelly stuff for you. Alright. So I'm going to take a look up in your nares. There is mild hair distribution. Mucous membranes are moist, intact. There are no lesions or foreign bodies. The septum does appear to be midline. The inferior turbinates are visible, but the superior turbinates are unable to be visualized. I think that's it. We already noted that they're patent. So we're going to move on down to your lips. I'm going to put your lips in your mouth. I'm going to put my gloves on. Open up wide for me and stick your tongue out and say ah.
Ah.
And the uvula does rise and fall midline. This is testing cranial nerves 9 and 10. The the glossopharyngeal nerve and the vagus nerve are, you can close your mouth, I'm sorry. Cranial nerve number 12 is the hypoglossal nerve, testing speech, gag reflex, and swallow. All right, open up for me. So the lips are pink. You don't have to open up too wide. The lips are pink. They are midline and intact. They are slightly moist, noting that the teeth are clean. They are all present and in good condition, noting the buccal membranes are moist. Looking at our sublingual frenulum, our superior and inferior frenulums are intact. The tongue is midline. It does have palpebrae towards the back. It is smooth along the edges, noting a hard and soft palate. Noting Wharton's and Stetton's glands. And I think that's it for your mouth. Moving on from there, we would move on to our breast or chest exam. We would want to note symmetry. We would, any pain upon palpation?
No.
So we would just note symmetry. If we were performing a breast exam, we would have you lay down, raise your arm above in a circular motion. We would palpate all the way out to the talus sphinx, and we would note that there is no drainage noted. While we're here also, we're gonna just watch for even breathing and just make sure everything is symmetrical. We're visualizing that there are no heaves or lifts. We would feel there are no thrills or murmurs noted. We would be able to palpate our PMI, or point of maximal impulse, which is our apical pulse. Moving on to the back, if you would sit up just a little bit for me. Perfect. And if you would say 99.
99.
99.
99.
Or if you, maybe you stand up, sorry. All right.
99. 99. 99. 99. 99. 99.
And with this, we're looking at tactile fremitus. We want to feel the vibration evenly dispersed along the vertebral column. And if you would take a deep breath for me. Awesome. So with this, we're looking for lung expansion, just making sure we feel even expansion on the left and the right side. And now I'm going to take a listen to you. Take a deep breath for me. Perfect. And with this, we're going to listen top to bottom and in a back and forth motion. Listening in all fields. Down and around under to make sure we hit the bottom lobes. Perfect. Also, we can measure lung expansion or diaphragmatic expansion. If you would take a deep breath and hold it, and we would percuss. We will draw a line and then take a deep breath, blow it out and hold it. Perfect. And we would percuss up and we would draw another line and we would measure, noting between 4 to 6 for a normal expansion. Just going to auscultate the front of your lungs. If you would lift your hands and put them over your head. Perfect. So again, we're going to continue to auscultate the bases all the way around. Perfect. And if you want to put your arms down and relax. Moving on to our cardiac assessment, we already said that we would feel our PMI. We would hopefully feel no thrills or murmurs. Gonna start off by listening to your cardiac sounds. Second intercostal right space is going to be our aortic. Second intercostal left, pulmonic. Moving down to our third Erb's point. Moving down 4 to 5 mitral and tricuspid. Also, with our cardiac assessment, we did the carotids. We listened for any bruits present, and we did not hear any. We would also palpate all our pulses. We would hope to find that they are equal bilaterally. Moving on down, that they were not bounding or thready. Palpating, we said temporal, carotids, brachial, radial. We would defer the femorals. We would palpate our popliteal, our posterior tibial, and our dorsalis pedis for all our pulses. Moving on, if you don't mind. Trying to think if I've missed anything. If you wouldn't mind taking off your shirt and laying down, I'm going to now perform my abdominal assessment. Visualizing the abdominal, it is positive for respirations and pulsations. It is smooth and rounded. There are minimal striae across the lower abdomen. The umbilicus is completely round. It is negative for Cullen sign, negative for blotment, normal male hair distribution. After I visually inspect it, we're going to auscultate all quadrants of the bowels. And they would be in a rate of about 10 to 35, noting that if we thought we didn't hear bowel sounds, we would need to listen for about 5 minutes in each quadrant. I'm now going to percuss the liver. Oh, I'm going to auscultate the liver first. Now I'm going to percuss the liver. We would draw a line, percussing top to bottom, and percussing again. And we would draw another line, measuring to make sure we do not have an abnormal liver size. We would move from resonance to dull, tympany to dull, and that's how we would know where to move our line or draw our lines. Looking at the spleen, we're going to palpate, or we're going to percuss and it should be dull past the costal margin. We should not be able to palpate the spleen. The spleen should be up under the costal margin, tucked away. After we've percussed, we can palpate the liver. Take a deep breath and cough for me. Perfect. And the liver is palpable. The margins are smooth. They are not rigid and without calcification. Again, we said we wouldn't be able to palpate the spleen. We are able to palpate, you're fine, just relax, the kidneys. They are freely movable. Sorry. They are retroperitoneal, freely movable, bilaterally on each side. We could also percuss the bladder, and we would hope it would sound dull. And I also forgot to note that we're going to auscultate our abdominal aorta, slightly left of the midline. Our renals, and our iliacs. And with this, we would want to hear no bruits. Bruits are signs of turbulence and disturbed blood flow. After that, we would lightly palpate the abdomen, moving around each quadrant, hoping to feel no abnormal lumps, any hard patterns, no hernias noted. As we move from light palpation, we're going to move to a deeper palpation, noting no abnormalities also. And that ends our abdominal portion of our assessment. Moving on to our feet, if you would lift your leg. And this is flexion. Put your leg down. Extension, and we'll hyperextend when we stand up. Push your foot down for dorsal flexion and push it up. Perfect. Inversion, eversion, and rotate your ankle for me. Perfect. And if you would invert against resistance and out. Thanks. And this is push down. That's plantar flexion and pull up. Dorsal flexion. Good. If you would move your leg out, and that is abduction, and move it in. Adduction, adding to the body. If you would sit like a lady, that's internal rotation, and then sling your leg out, hit your knee to your knee. Perfect. Internal rotation. If you would bend your knee up. Perfect. And that's flexion, and put your leg down. Extension, we would never hyperextend the knee. If you would stand up for me. And face. Yeah, that's good. So with this, I'm not sure where to stand, I'm sorry. Move closer so the camera can see you. Okay, so with this, we're going to hyperextend our leg behind us. Perfect. And we're going to touch our toes. And this is extension, or flexion, extension, hyperextension. Awesome. And if you would flexion your chin, extension, hyperextension. We're going to move to rotate to the left. I mean right, sorry. Left and rotate. Awesome. And again, against resistance. Perfect. Perfect. Forward. Perfect. And back. Awesome. If you would, we're going to abduct your arms and adduct your arms and rotate them. Perfect. And we're going to flex our elbows, extend our elbows. We would never hyperextend our elbows. And against resistance. Perfect. And against resistance. Perfect. We're going to pronate. We're going to supinate. Perfect. And we're just going to touch each finger for dexterity. Perfect. And rotate our wrists. Awesome. All right, hands out. We're going to do flexion, extension, hyperextension. And then we're going to do fingers. Flexion, extension, hyperextension. Perfect. And we're going to abduct our fingers, and then we're going to adduct our fingers. Perfect. And we're going to lean to the left. And this is just flexing our hips. And then if you would rotate your hips. Perfect. And if you wouldn't mind bending over and touching your toes. And again, we already noted the paravertebral muscles, but just moving down, we're notating the spine has no signs of scoliosis, lordosis, or kyphoidosis. Any pain with any of those movements or stretching. We would also palpate all our joints, any pain or tenderness. Moving down to the lower extremities also. No crepitus is noted, no pain, no swelling. Trying to think. Oh, I'll scan the room. All right, and if you would, I'm just going to visualize your gait. Take a walk for me, just a normal, casual walk. Perfect, and then if you'd walk back heel to toe as straight as possible. Perfect. Now, stand in front of me, and we're going to take our heel to our ankle, and then our other heel, just rub it straight down your leg. Perfect. We're also going to do a Romberg's test. Close your eyes and try to maintain your balance. Perfect. If you would sit down for me. And try to cross your legs like a lady. Okay, and then your other one. And this is testing his glutes and his hamstrings. Just looking at his posture, he has great posture. We're going to do item identification. If you would hold your hands out for me, close your eyes, and tell me what you feel.
Coin.
Okay. And then tell me what you feel.
A key.
Perfect. We're going to do paint point location now, if I can pick a thing. And identifying our items, that was diagnosis. Close your eyes and put your hands out, palms out. Perfect. So you're going to feel 1 point or 2 points. And you tell me if you feel 1 or 2.
1, 2. 1.
Sorry.
2. 2. 1, 2. 2.
Perfect. And we would perform these on the upper extremities, lower extremities, and our core. Moving on from paint point location, we're going to move on to vibration sense. and close your eyes. I'm going to place a vibration on your joint, and you just tell me when you feel it and where you feel it.
My left elbow. My left knee. Right thumb. My right big toe.
Awesome. We're now going to do, if you would hold your fingers out for me, and this is up, neutral, and down. So you tell me when I move, either a finger or a toe.
Up. Down. Up. Down. Up.
Perfect. We're now gonna do our reflexes. And if you would, I'm just gonna support your arm. First we're gonna do the tricep. Moving on to our bicep. Oh, just relax your arm for me. Perfect. It would be easier if we had a table off the ground. We would do your popliteal, and then I would get you to turn around on your knees on the couch. And with this, we would do the Achilles. Noting +2. You're fine, you can turn around. Just making sure I hit everything. Listen to everything. And I think we're done. Thank you.